Hello my friend, welcome once again to my channel. This is your girl Nora, and in this particular video I'm going to talk about female infertility. What is female infertility? Female infertility is when a woman has failed to conceive. In this video I'm going to explain what it is. What are the causes? So if you would like to order any of our herbal products, go to noraarake.com/shop. So without further ado, let's get into the video. The main symptom of a woman's infertility is failure to get pregnant. Now, female infertility is diagnosed when a woman has failed to conceive for over a period of a year after trying and they just can't get pregnant. Some causes are known and others are unknown. In this video, I'm going to break them down. I'm going to explore what are the possible causes of female infertility. Female infertility takes over 1/3 of all infertilities. Over 50% of all infertility cases worldwide are women. Why is this so? Let's see. Most common causes of female infertility include problems with ovulation, damage to fallopian tubes or the uterus, or problems with the cervix. Age can also contribute to a woman's infertility because as a woman ages, her fertility levels tend to decrease. Ovulation problems may be caused by one of the following: hormonal imbalances, a tumor or a cyst, eating disorders like anorexia or bulimia. It could even be intense exercise, which could cause a significant loss of body fat. Menstrual cycle issues, menstrual cycle problems, especially in cases of extreme brief menstrual cycles. Remember, to get pregnant, you need to ovulate. And with ovulation disorders, where you ovulate less or even not at all, there is a problem getting pregnant. Problems with the regulation of reproduction hormones by the hypothalamus or the pituitary glands, or problem in the ovaries can cause ovulation disorders. The PCOS, polycystic ovary syndrome, causes a hormonal imbalance which affects ovulation. PCOS is associated with insulin resistance, obesity, abnormal hair growth on the face, on the body, and acne. It is the most common cause of female infertility. Hypothalamic dysfunction. Two hormones produced by the pituitary gland are responsible for reproduction and fertility in women. Are responsible for stimulating ovulation every month. Follicle stimulating hormone and luteinizing hormone. Excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or weight loss can disrupt production of these hormones and hence affect ovulation. Now listen, irregular or no periods at all are the most common signs of disruption in ovulation. There is premature ovarian failure. This can also be called primary ovarian insufficiency. This disorder is usually caused by autoimmune response or premature loss of eggs from the ovary. This can be possible from genetics, when someone grew up like that, or even chemotherapy. Here, the ovary no longer produces eggs, and it lowers production of estrogen in women, especially under the age of 40. Then there is too much prolactin. The pituitary gland may cause excess production of prolactin, also called hyperprolactinemia. This reduces estrogen production and it may cause infertility. This is usually related to a pituitary gland problem, and it can also be caused by different medications, which you may be taking for another disease. Now, there is also tubal infertility, damage to the fallopian tubes. Now, damaged or blocked fallopian tubes stop. It's blocked. There is no passage. It's blocked. It stops the sperm from passing through to go and meet the egg. Even then, it can block the passage of the fertilized egg to go to the uterus. You understand properly? There is also pelvic tuberculosis. It's a major cause of tubal infertility the world over. Endometriosis is another one. This occurs when tissues that normally grow in the uterus implant themselves and grow in other places other than the uterus. Endometriosis. This ends up disrupting the implantation of the fertilized eggs in the uterus. This affects fertility in a way because this may cause damage to the egg or even to the sperm. There is uterine and cervical causes. Several uterine and cervical causes can impact fertility by interfering with implantation or even increasing the likelihood of a miscarriage. You find benign polyps or tumors, fibroids, myomas are common in the uterus. Some can even block fallopian tubes or interfere with implantation. Remember, I told you these are monsters that have their own life growing on their own inside your body, inside your uterus, disrupting implantation of the egg, of the fertilized egg. So this also affects fertility. Some women with myomas, with fibroids, sometimes get pregnant, sometimes not at all. There are also uterine problems that present themselves from birth, like it's a defect, like how someone is born with maybe one leg or half leg. This can also be just a defect. Uterine abnormalities, for example, abnormally shaped uterus, which can cause problems becoming or remaining pregnant. Now, there is cervical stenosis, which is a narrowing of the cervix. This can be inherited malformation or damage to the cervix itself. Sometimes the cervix can't even produce the best type of mucus, which allows the sperm to travel through, to swim through the cervix into the uterus. Now, there is also unexplained infertility. Sometimes the cause of infertility is never found. The doctors examine you, everything seems normal, everything seems perfect, but you are just unable to conceive. It could be a combination of issues between the two partners, the man and the woman. Sometimes this problem corrects itself with time. As time goes on, as you continue to live with this person, sometimes the problem corrects itself. Damage to the fallopian tubes can also be caused by pelvic inflammatory disease, a previous infection, polyps in the uterus, endometriosis or fibroids, like I said, scar tissue or adhesions, chronic medical illnesses or illness, a previous ectopic tubal pregnancy, a birth defect like I explained it, or death syndrome. Now, there is this medication, DES. This DES syndrome given to women in order to prevent them from getting miscarriages can later cause the children they give birth to be infertile. A menstrual cycle that's too long, like 35 days or more, or too short, like 21 days or even less, could be another symptom of infertility in a woman. Irregular or absent menstruation periods can be another indicator that you are not ovulating. Pelvic inflammatory disease, PID, an infection of the uterus and fallopian tubes, which comes as a result of chlamydia, gonorrhea, or any other sexually transmitted diseases, STIs. There are also previous surgeries in the abdomen or the pelvic area, like abortions, even surgeries of ectopic pregnancies, where a fertilized egg implants itself and develops in the fallopian tube instead of the uterus. There are certain factors that put you at a higher risk of infertility. For example, age. You know, as you age, the quantity and quality of eggs of a woman begin to decline as you age. In mid-30s, the rate of follicle loss speeds up, resulting in poorer and poorer egg qualities. The quality of your eggs becomes poorer and poorer. This makes conception difficult and increases the risk of miscarriages. Another one is smoking. Besides damaging your cervix and fallopian tubes, it increases the risk of miscarriages and ectopic pregnancies. It's also thought to age your ovaries and deplete your eggs prematurely. Whether you smoke or whether you are a direct smoker or a passive smoker, it doesn't matter. So before you begin any fertility treatment, stop smoking. Being overweight is another factor. Weight. Being overweight or significantly underweight may affect normal ovulation. If you have a normal body mass index, this may increase the frequency of ovulation and likelihood of pregnancy. Sexual history is another factor. Sexually transmitted diseases like the ones I talked about and others can lead to blocked tubes, especially when girls are young. They don't know that they have sexually transmitted diseases. They get the infections and they don't even mind. Go ahead to treat them. They think it will go with time. They don't mind it until they are of age. It starts to affect them. Having unprotected intercourse with multiple partners increases your risk of getting these STIs, which may cause a problem of infertility later. Alcohol. You know, like I always tell you, too much of anything is always bad. Now, if you must take alcohol, stick to one alcoholic drink a day or even less, or skip days. It's not a must to use alcohol every day. It becomes alcohol abuse. So, how do you handle prevention of female infertility in women today? Because it is an increasing problem that women are having these days. How do you handle it? Because if you are treating yours, remember there is another generation. You have a daughter or you have a son who will have a wife. So How are we going to help this generation to prevent constant occurrence of female infertility today? Take steps to prevent STDs. Talk to the children, even yourself. Talk to your children. Talk to everyone about the dangers of having unprotected intercourse with multiple partners. Even we adults. Avoid illicit drugs. Avoid alcohol abuse. Heavy and frequent alcohol use. Stop it. Adopt good personal hygiene. I will record a video about how to maintain personal hygiene. Adopt good personal hygiene and healthy practices. Once you are sexually active, always get checkups from your gynecologist. Don't wait to feel like there is something wrong to look for a gynecologist. As a lady, always have yourself checked to make sure you are in shape and you are okay. For women thinking of getting pregnant and having children in the future, or soon, these tips may help to optimize fertility. Maintaining a normal weight. Because overweight and underweight women are at a risk of ovulation disorders. So try to maintain a normal weight. If you feel you need to lose weight, exercise moderately. Eat right. Intense exercises of long hours, I told you, they affect fertility. Stop smoking. Quit smoking. Tobacco has very negative side effects on fertility and also the general health of your fetus. Also, do everything in your power to reduce stress. Yes, reduce stress. If you feel you're so stressed, do something about it. You can talk to me. You can book your online counseling session at norarake.com/booking. Do everything in your power to cut on stress. If you are planning to get pregnant and to have a healthy delivery period and pregnancy period. Limit caffeine as much as you can. Do everything in your power to limit caffeine. At least 200 milligrams or less a day, or even do away with it completely. And also, don't ignore some signs. There are some signs you are not supposed to ignore as a woman. It's not about just seeing the gynecologist because you want a checkup. Also, study your body. If you realize you have abnormal bleeding, you have fevers, delayed menstruation, excessive cramps, too much abnormal pain, abnormal bleeding, unstable periods, consult your gynecologist. You see you have pain and discomfort during intercourse. Don't take it for granted. You have soreness and itching in the V area. Don't take it for granted. So we have all these herbs. All you have to do is order at norarake.com/shop to get these herbs. And also, if you have not understood anything, just comment in the box below. I will record about the foods that boost fertility. It's the next video from this one. Yes, thank you so much for watching my video. I hope you've learned something. I hope you have liked it. Give it a thumbs up, share this video, and don't forget to book your one-on-one counseling session with norarake.com/booking. Thank you. Bye.